Last year, data shows there were over 5 million opioid prescriptions prescribed in Indiana. Some officials believe people who are prescribed opioids aren't always aware of the addictive nature of the pills. Recently, Nicole Kersine spoke with an Indiana senator about a bill to help provide transparency about opioids. He joins us now with how that bill is designed to help one population in particular.
And those are some of the older patients that are getting prescribed these opioids, Mike. Nearly 1 in every 6 opioid-related death in Indiana in 2017 was a person aged 55 or older. But now there's a law in place to help older Hoosiers better understand exactly what they're being prescribed.
I think we're going to have to attack this problem from all angles.
As Hoosiers continue to abuse opioid prescriptions, with sometimes fatal results, prescribers continue to regularly prescribe the addictive drugs.
It's easy to get patients when you have a busy schedule in and out of the office to treat their symptoms with this medication, which is very effective in treating symptoms in a short course.
One demographic that is susceptible to these multiple prescriptions is the elderly.
Elderly oftentimes are on lots of medicines. There's very little chance for them to understand all of what there is to know about all of those medications.
State Senator Jean Lysing learned from a committee member about the prevalence of opioid addiction in senior citizens.
She said, I really think that a lot of these seniors don't understand the difference between opioids and other pain relief medications. And so she said, I said, so what's the solution? And she said, well, maybe just as simply something on the label of the prescription bottles.
Lysing then authored Senate Bill 133, which was passed into law in the spring and requires prescribers to label a prescription clearly as an opioid rather than burying that information in a handout.
When you get a prescription pill now of any sort, you get that big printout, that tells you all about the medication. But most of the time when people get that, they don't read that from top to bottom, right?
Lysing is hoping this simple change will warn patients of the highly addictive nature of opioids and keep them from taking too many.
It's not like an antibiotic. You don't have to take all the pills until it's gone.
And Lysing says this law is designed to help any patient, not just senior citizens.
Whether it's a teenager that has a sports injury or a super senior that's had back and hip surgeries, I'm all about trying to keep them away from any kind of addiction.
Now, Senator Lysing says this is just one step toward the fight against opioid addiction, and she will continue to look for other ways to combat this crisis.
It was mentioned 5 million prescriptions, right?
Yes.
But there are a lot more pills out there, right?
Right. You don't get a prescription with just one pill in it. According to Inspect, Indiana's prescription drug monitoring program, there were over 333 million opioid pills prescribed. There's only 6.6 million people who live in Indiana, so if you think about that, how big of a scope that is in our state.
Yeah.